Flint became under the control of emergency management. And the emergency managers had one job, and that was austerity. It was all about saving money. And they decided that to save money, they would change the water source from the Great Lakes to the Flint River, because evidently that high quality water was now too expensive for this predominantly poor, predominantly minority, near bankrupt city. So in April of 2014, with a simple press of a button, our water source was switched from the Great Lakes to Flint River. Just a few months after our water switch, General Motors, born in Flint, noticed that our drinking water was corroding their car engine parts, and they were allowed to go back to Great Lakes water. Yet the people of Flint were literally told to relax, that everything was okay.
Most heinous part of that was that children unknowingly ingested a lot of lead into their system. While that was not good for anybody, it's very, very detrimental to children because of the way lead affects children more so than adults.
Lead is a poison. It is a neurotoxin.
Thought at the time is there had been over 6,000 children in Flint under the age of 6 affected by the water crisis, and then another 20,000 under the age of 18.
Lead exposure has really well-known consequences, but the hard thing with lead is that you don't necessarily see the consequences right away. It's known as a silent pediatric epidemic.
We don't think we've seen the height of the effect of the lead. The demand for our services is just going to continue to increase along with the other services that we provide.
When the emergency declaration was made for the Flint water crisis, that's when GHS really became involved in helping the community to recover.
There is a lot that science tells us we can do to promote the health and development, especially of our children.
A big part of GHS mission has always been taking care of the children in the community that need the services that we have.
We know that early intervention is the key to helping individuals with disability and mental health issues live successfully in the community. And that's what community mental health is all about, and that's what we do.
One of the largest obstacles that I saw when I looked at the programs and the work they were trying to do is the buildings. Our buildings were remodeled or built a long time ago.
For Flint families who are already struggling with so many traumas and obstacles, it's really hard to get your kids what they need, and especially if they're all in different places.
Most families have multiple children, which means they have multiple needs, and they could also have children in multiple programs at multiple buildings. It just makes everything very complicated for families to receive services.
There are a lot of places that parents can go to get help for their children, but one of the problems is the fact that there are a lot of places. So building one place, building Children's Integrated Health Center, and putting it in a prominent location will help to not only make those parents feel like their children are cared for in this community, but give them one place to go.
Having a new facility like the GHS facility with its wraparound services, with so many resources in one place, is critical for our families.
We need to remove that obstacle with a community effort to build a Children's Integrated Health Center for this community so the staff can work together and collaborate, and the people going there can go to one nice new building to receive the help that they need for their children.
This project is important because it gives the kids of Flint and Genesee County world-class access to behavioral health to make their lives wonderful.
It's also critical for our families to have something new and beautiful. For so long, there hasn't been anything new and beautiful in the city of Flint, and it even provides a symbolic message to our children that they are worth it, and that they deserve it, and they are valued. And I think that's one of the best things about having a new building.
This building's going to do a lot of things for this community, almost more than I can enumerate.
When they come visit me and we do our meetings, they think about the kids. My kids interact them more. We do my paperwork and get done. They go, they doing their time with my kids. Like, they good with kids too. They motivate kids. They love my kids like I love them.
People of the community needed care, and GHS was there to provide that care.
I don't know where I would be, because where I'm at now is because of them and my family.
We're really excited to be able to work more together and to really provide comprehensive care to the families that we serve.
What happened in Flint has been a trauma. It's been a trauma atop many traumas. And the most important thing that we can do to provide our children is the necessary resources they need to be properly assessed and treated so that they can go on to live healthy and successful lives. All of this work is only possible with our partners at GHS. The incredible work that they're doing with outreach and mental health care and home visiting and the Let's Safe Home program and the Neurodevelopmental Center of Excellence are all critical ingredients to our recovery. And I couldn't be more grateful to work with the folks at GHS to make this all happen.